They a murder when they say it's for your teeth. They calling for the murder of the rights of free speech. Cease and desist cause the system is weak. They can't exist if you resist the deceit. They persistently preaching. I can't do this alone, but you know that I'm keeping up with this fight. Listen up if you like your God-given right to be free to believe. Yo, believe what you might, but we need to agree to proceed to the life of the world. For every little boy and every little girl growing up in this mess that we left.
In areas where fluoridation is deliberately added is fluorosis. And in communities like ours, where fluoride is kept at quite a low level, that usually means white spots on the teeth that wouldn't be noticeable to most untrained eyes. In communities like rural communities where well water has naturally occurring levels of high fluoride, that actually can result in more serious impacts. So brown mottling of the teeth is the more moderate or severe version of fluorosis. So what they're saying here is that is particularly in areas with naturally occurring fluoride, make sure it's not getting too high to prevent fluorosis. They identified water fluoridation as a practical way to address oral health inequities. That mirrors a finding from our 2008 review. When we looked specifically at if we weren't fluoridating water, how else could we get fluoride to people? How else could we provide good dental prevention? And we found some options that were all significantly more expensive than water fluoridation. The review also looked at Canadian opinions and found a majority were either in support of or not opposed. And as you'll note in the report, a recent study in Halton showed 64% of people there were in support of water fluoridation. So we've done an environmental scan looking at decisions by political bodies to continue, to discontinue, or to initiate water fluoridation. This is not as systematic. There isn't a registry where we can look at all these sorts of communities. But we've done what we can, mainly through online news reporting. We found in January 20, I'll go through these relatively quickly. There's a couple that are interesting and I'll spend a little bit more time on. But in January of 2012, Halton decided to continue water fluoridation. Peel in April of 2012 decided to continue water fluoridation. These are decisions at regional council levels. Toronto, the Board of Health decided to continue fluoridation in April of 2011. Makoteta, Iowa City, decided to initiate fluoridation in January 2012. Pinellas Park, Florida initiated fluoridation in January 2012 as well. The state of Arkansas implemented a new law initiating fluoridation in all systems over 5,000 people. So this is a state law where if you're providing water to over 5,000 people, you have to now fluoridate that water. It mirrors California legislation, which has been in place for quite some time, that has the same impact. And there's actually a really interesting story that's come out of the California legislation. The city of San Diego had, for a very long time, jumped through a loophole in California legislation that said, if you can't afford water fluoridation, you don't have to provide it, even if you otherwise meet the criteria under the legislation. So the city of 1.4 million people had claimed that they couldn't afford to fluoridate their water. So a local children's rights group called First Five, this is a group that lobbies and advocates and provides services to improve child health in the San Diego area. They raised $4 million, $3.9 million. They gave it to the municipal government in San Diego and they said, now it's time to fluoridate. That happened in February of 2011. Port Macquarie, Hastings, Australia also initiated water fluoridation in February 2012. Communities that discontinued water fluoridation in the past year include Amherstburg, Ontario, January 2012. Lakeshore, small community, neighboring Amherstburg. And then the BC communities, Williams Lake and Lake Cowichan, BC. This is my last slide before I turn over to Dr. King. This is Ontario data on water fluoridation. And what it shows on your horizontal axis is what proportion of people in your community have water fluoridation. So this is 30 health units in Ontario that reported to the Chief Dental Officer of the province, and this analysis was done at that level. So you've got from nobody fluoridated to 100%, almost 100% people in the area fluoridated. In Hamilton, we have something like 75, so we're one of these two dots here. You can see that in the smaller communities, there's a lot of random variation, so people are far off that line. In the larger communities, fairly consistently near that line. And this line is a line of best fit, statistically very significant in the analysis that was done here. What it shows is that the lower your, sorry, I didn't tell you what your x-axis, your vertical axis is here, your y-axis. This is decayed, missing, and filled teeth. DMFT scores you'll hear, a fairly common measure of oral health. The higher, the worse. So, you know, if you've got one cavity, you'd end up here as a 1. If you got three cavities, you'd end up here. The relationship is fairly strong. The more people receive fluoridated water in your community in Ontario, the less cavities and the lower the DMFT score. What this means that if you took a community like ours with a DMFT score of about 1.5 and you discontinued water fluoridation, it suggests that on average we'd be up around the 2. So about half a cavity per person and sort of 5-year-old child. So half a cavity per 5-year-old child, which is about a 30% increase. We used a much more conservative estimate in the report to estimate that if water fluoridation were discontinued in Hamilton, again, we're talking about the Woodward Water Treatment Plant, which provides water to about 385,000 people in Hamilton. And over a 10-year period, we estimated that based on the US CDC's number, which is an increase of 93% cavities, we probably have in the range of 139,000 additional cavities in Hamilton over 10 years. If you use Ontario data, 30% rather than the 19% US CDC data, you'd have a much bigger figure. So I'm going to turn it over to Dr. King now, and we'll take questions at the end of the 2 presentations.
Thank you very much, Dr. Mackey, and I'm delighted to be here in support of your local medical officer of health and associate medical officer of health with respect to this issue. Community water fluoridation is one of the greatest public health achievements of the 20th century. This has certainly been stated by both the U.S. Centers for Disease Control and by our Canadian public health associations. It is supported by more than 90 national and international organizations as the most cost-effective and equitable strategy for the prevention of dental decay. And I want to assure you that fluoridating drinking water is safe, it's effective, it's economical, and it's equitable. It reaches everyone. In Ontario, fluoride additives must meet standards of quality and purity before they can be used. In Ontario, fluoride additives are regulated by the Ministry of the Environment, and this is not the norm across the country. In fact, we have some of the strongest regulations in the country related to this issue.
The greatest trick the devil ever pulled was convincing the world he didn't exist.